ಮಣಿಪಾಲದ ಮಾಹೆ ವಿವಿಯಿಂದ ಉಡುಪಿಯ ಹಾವಂಜಿಯಲ್ಲಿ ನಿರ್ಮಿಸಲಾದ ದೇಶದ ಎರಡನೇ ಅತಿದೊಡ್ಡ ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಸ್ ಮತ್ತು ರೆಸ್ಟ್ರೈಸ್ ಸೆಂಟರ್ ಅನ್ನು ಆಂಧ್ರಪ್ರದೇಶದ ರಾಜ್ಯಪಾಲ ನಿವೃತ್ತ ನ್ಯಾಯಮೂರ್ತಿ ಸೈಯದ್ ಅಬ್ದುಲ್ ನಜೀರ್ ಅವರು ಉದ್ಘಾಟಿಸಿದರು. ಈ ವೇಳೆ ಮಾತನಾಡಿದ ಅವರು, ಮಾಹೆಯು MHRC ಯೋಜನೆಯ ಮೂಲಕ ಗಂಭೀರ ಮತ್ತು ಜೀವನದ ಕೊನೆಯ ಹಂತದಲ್ಲಿರುವ ರೋಗಿಗಳ ಮತ್ತು ಅವರ ಕುಟುಂಬದವರ ನೋವು ನಿವಾರಿಸುವ ಮಾನವೀಯತೆಯ ಕೆಲಸವನ್ನು ಒಂದು ಮೂಲಭೂತ ಮಾನವ ಹಕ್ಕು ಎನ್ನುವಂತೆ ಪರಿಗಣಿಸಿರುವಂಥದ್ದು ಶ್ಲಾಘನೀಯ. 2022ರಲ್ಲಿ 14 ಲಕ್ಷ ಹೊಸ ಕ್ಯಾನ್ಸರ್ ಪ್ರಕರಣಗಳು ಭಾರತದಲ್ಲಿ ವರದಿಯಾಗಿವೆ. ಇನ್ನು ಅದರಲ್ಲಿ 10% ಜನರಿಗೆ ಮಾತ್ರ ಆರೈಕೆ ಪಡೆಯುವ ಆರ್ಥಿಕ ಶಕ್ತಿ ಇದೆ. MHRC ಯೋಜನೆಯು ಒಂದು ಮಹತ್ವದ ಹೆಜ್ಜೆಯಾಗಿದೆ ಅಂತ ಅವರು ಹೇಳಿದರು. ಈ ವೇಳೆ ಮಾಹೆ ಟ್ರಸ್ಟ್ನ ಟ್ರಸ್ಟಿ ವಾಸಂತಿ ಆರ್ ಪೈ ಮತ್ತು ಮಾಹೆ ಟ್ರಸ್ಟ್ ಅಧ್ಯಕ್ಷರು ಮತ್ತು ಮಣಿಪಾಲ್ ಶಿಕ್ಷಣ ಮತ್ತು ವೈದ್ಯಕೀಯ ಸಮೂಹದ ಮುಖ್ಯಸ್ಥ ಡಾಕ್ಟರ್ ರಂಜನ್ ಪೈ, TMI ಫೌಂಡೇಶನ್ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಅಶೋಕ್ ಪೈ, ಸಂಸದ ಕೋಟಾ ಶ್ರೀನಿವಾಸ್ ಪೂಜಾರಿ, ಶಾಸಕ ಯಶ್ಪಾಲ್ ಆನಂದ್ ಸುವರ್ಣ, ಮಾಜಿ ಶಾಸಕ ಅಭಯಚಂದ್ರ ಜೈನ್ ಮತ್ತಿತರ ಗಣ್ಯರು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಉಪಸ್ಥಿತರಿದ್ದರು. ಇನ್ನು MHRCಯು ಮಣಿಪಾಲದ ಹೊರಭಾಗದ ಸ್ವರ್ಣ ನದಿಯ ಉದ್ದಕ್ಕೂ ಪ್ರಶಾಂತವಾದ 12 ಎಕರೆ ಕ್ಯಾಂಪಸ್ನಲ್ಲಿದೆ. ರೋಗ ಗುಣಪಡಿಸಲಿಕ್ಕೆ ಅಗತ್ಯವಿರುವ ಶಾಂತ ವಾತಾವರಣ ನಿರ್ಮಿಸಲು 78% ಪ್ರದೇಶದಲ್ಲಿ ಮರಗಿಡಗಳಿಂದ ಕೂಡಿದ ಹಸಿರು ಪರಿಸರವನ್ನು ಉಳಿಸಲಾಗಿದೆ. ರೋಗಿಗಳಿಗೆ ಸಮಗ್ರ ಮತ್ತು ರೋಗಿ ಕೇಂದ್ರಿತ ಆರೈಕೆ ನೀಡಬೇಕು ಎನ್ನುವ ಉದ್ದೇಶದಿಂದ ಇದನ್ನು ನಿರ್ಮಿಸಲಾಗಿದೆ. ಈ ಸೇವೆ ಸಂಪೂರ್ಣ ಉಚಿತವಾಗಿದ್ದು 2025ರ ಜೂನ್ 1ರಂದು ಕಾರ್ಯಾರಂಭ ಮಾಡಲಿದೆ.
Justice Sri S. Abdul Nazir Ji to inaugurate the most awaited Manipal Hospice. Is now signing the certificate officially commending on with the singular mission of offering holistic patient-centered care to those suffering from life-limiting illnesses. So beyond medical treatment, it offers emotional, psychological and spiritual support, helping patients and their families walk this journey with dignity and peace. This hospice embodies the belief that when cure is no longer possible, care becomes even more important. It stands as a shining example of what humanity can achieve when compassion leads the way. Here is a glimpse of Manipal Hospice and Respite Center, a video that will showcase you the center and its world-class facilities for the healthcare service, education and research.
And care continues when cure is no longer possible. Across India, millions suffer silently in their final days, without relief, without comfort, and often without choice. With over 96% of people experiencing pain and suffering at the end of life, and less than 4% receiving effective relief, we face a moral imperative. Families grow poorer under mounting health costs, only to see their loved ones die in ICUs, far from home, far from peace. It was time for a change. The Manipal Hospice and Respite Center, a philanthropic initiative by the Manipal Academy of Higher Education, is that change. It envisions a world where dying is not feared, but met with understanding, comfort, and love. Where communities embrace life, limiting illness with courage, and every person receives a good death, regardless of illness, background, or ability to pay. At MHRC, hospice care is holistic and human. Here, a multidisciplinary team of doctors, nurses, counselors, volunteers provides not only medical care, but emotional, spiritual, and psychological support. Pain is relieved. Wounds are tended. Conversations are held with warmth and honesty. Patients and families are guided through end-of-life transitions with dignity, privacy, and the power to choose where and how they wish to spend their final days. Respite care at MHRC supports those who continue to live with advanced illness, adults and children alike. Whether it's unresolved symptoms, caregiver burnout, or the need for physical and emotional rehabilitation, MHRC offers rest, renewal, and relief. It empowers families, bridges gaps in care and communication, and walks beside each patient and caregiver, one step at a time. More than a place of care, MHRC is also a center of learning and advocacy. From short courses in palliative care to community awareness programs and advanced training for healthcare professionals, it is building the future of compassionate care. Through advocacy for opioid availability, advanced care planning, and research, MHRC seeks not just to serve, but to transform how we approach life, death, and everything in between. Each year, thousands of lives in this region will find solace here. Patients of all ages with cancer and non-cancer conditions alike. From adults with cancer to the elderly with dementia, from trauma survivors to children with rare genetic conditions, every story is honored. Every life, no matter how short or long, is held with care. Our aim is to ease the financial burden, foster family resilience, and build a more compassionate community. All patients cared in this facility and their families are supported with absolutely no cost, and all services provided here are completely free. The ethos of MHRC is simple but profound. Compassion, care, commitment. Communicating with compassion, providing care with comfort, commitment to uphold each person's dignity at the end of life. Because even when medicine can no longer heal the body, kindness can still heal the heart. As we embark on the mission of Manipal Hospice and Respite Center, we celebrate more than a facility. We celebrate a promise. A promise to listen, to support, to be present. And above all, to remind every patient and every family that they are not alone.
ಮಾತರಿಗಳ ನಮಸ್ಕಾರ. ಇಲ್ಲಿಯ ಫೆಸಿಲಿಟೀಸ್ ನೋಡಿದ ಮೇಲೆ ಬಹುಶಃ ನನಗೆ ಶಬ್ದಗಳೇ ಬರ್ತಾ ಇಲ್ಲ ಏನು ಹೇಳಬೇಕು ಅಂತ. ಒಂದು ಚಿಕ್ಕ ಭಾಷಣ ಮಾಡೋ ಮುಂಚೆ ಒಂದೇ ಒಂದು ಶಬ್ದ ಹೇಳ್ತೇನೆ. ನಿಮಗೆ ದೇವರು ಇನ್ನೂ ಒಂದಷ್ಟು ಶಕ್ತಿ ಕೊಡಲಿ. ಈ ಬಡವರು, ಈ ವಯಸ್ಸಾದವ್ರನ್ನ ನೋಡ್ಕೊಳ್ಳುವಾಗ, ಈ ಕಾಯಿಲೆ ಹಿಡಿದವರನ್ನು ನೋಡ್ಕೊಳ್ಳಿಕ್ಕೆ ದೇವರು ನಿಮ್ಗೆ ಇನ್ನೂ ಒಂದು ಸ್ವಲ್ಪ ಶಕ್ತಿ ಕೊಡಲಿ, ಆರೋಗ್ಯ ಕೊಡಲಿ ಅಂತ ಇಷ್ಟೇ ನಾನು ಬೇಡ್ತೇನೆ. It gives me immense pleasure to be here today amongst you all on the auspicious occasion of inauguration of Manipal Hospice and Respite Center established by Manipal Academy of Higher Education as part of its philanthropic and social impact initiative. I appreciate MAHE leadership for their noble initiative in establishing this pioneering project in India with an aim to alleviate the pain and suffering of people with advanced and terminal illness and to extend support to their families by considering it as a fundamental human right. The vision behind this philanthropic project to provide a compassionate, high quality, dignified palliative and end-of-life care for all the individuals and their families reminds me of the age-old adage, Manava Seve, Madhava Seve, meaning service to mankind is service to God. The statistics relating to people suffering from life-threatening cancer disease in India is very alarming. India reported 1.4 million new cancer cases in 2022 alone, which equates to 100 cases per 1 lakh people. And there have been 12.85 million deaths attributed to cancer alone. According to estimates, in India, 1 in 9 people are likely to develop cancer in her lifetime. And it is projected to increase by 12.8% shortly. I don't want to give the dates because it is very alarming again. It's a matter of grave concern to note that out of the people requiring palliative and hospice care, particularly at the end of life stage, less than 10% has access to such services, leaving about 7.5 million people who need respite and rehabilitative care to endure severe health-related suffering. This appears to be mainly due to the prevailing hospital-based healthcare model, leading to patients facing significant distress from therapy-related costs that can consume nearly half of their household earnings.